Local lawmakers and EMS agencies continue the push for Governor Hochul's signature on a bill that would regulate how first responders are paid for emergency care. Natalie Kutchko joins us with more on the demands to pass the direct pay bill. Natalie.
Hi, Teresa. As you mentioned, the bill is now before the governor and would ultimately require health insurance plans to immediately reimburse ambulance providers when transporting a patient out of network. EMS companies are hoping this is passed sooner than later to continue timely care and minimize a financial burden. The direct pay bill, which has unanimously passed both the Senate and Assembly, would require health insurance plans to immediately reimburse ambulance providers when transporting a patient out of network. For local companies like CHS Mobile Integrated Healthcare out of Henrietta, it's resulted in hundreds of thousands of dollars lost per year.
We specifically lose about $500,000 a year in lost or kept checks. There's also the problem of, some people intentionally keeping checks because it is written out to them. And unfortunately, we default to a collection agency at some point because now we're chasing people that, have, intentionally creating insurance fraud and keeping money that is not theirs. And they realize that we have very little power over them to collect that money.
Health insurance companies are pushing back. If the bill passes, it would regulate cost control for those insurers. Lawmakers like Assemblymember Harry Bronson share the concern with emergency care providers.
What happens is we then are asking our volunteer ambulance services to become a collection agency. That takes time. That takes money. And it distracts them from the job we're asking them to do.
Should the legislation be dismissed, ambulance providers say there could be a ripple effect on response times.
We're very frequently having to go out and help our neighbors, and occasionally they help us. And as a result, we're really reliant on each other. So our neighbors and ourselves being financially sound is critical to ensure that response times remain the way they are and we can get ambulances to people who need them in a timely manner.
We did reach out to the governor's office on this today. A spokesperson tells us the legislation will be reviewed. Hochul has a 10-day window from when the bill is called up to either pass or veto the bill. If there is no action, the legislation would take effect in January of 2025. Teresa?
All right, Natalie, thank you. We'll keep an eye on that.